Netherlands. Коллеги, мы начинаем. У нас сегодня в гостях выдающийся ученый, птицевод, который посвятил всю свою жизнь изучению птицы, болезней птицы. Это ветврач, окончил 2 университета, Каирский, Гиссенский. В Мюнхенском университете он защитил докторскую диссертацию. Он является почетным профессором Гогенгеймского, Александрийского университета и Египте. И работал многие годы в Свободном университете Берлина руководителем Института болезней птиц. Имеет огромное количество грамот, наград. Значит, являлся с 2013 года, является членом зала почета Всемирной ветеринарной птицеводческой ассоциации, организатор симпозиумов по индейке. В течение многих лет, в 2019 году, перед пандемией, он провел 13-й симпозиум международный по болезням индейки. Вот. Я все их посещал с огромным удовольствием. Ну и кроме того, замечательный, прекрасный человек. Поэтому давайте послушаем его презентацию. Я отключаюсь, а он включается.
Okay, what shall I do now?
Мы переводим. Сейчас он запустит презентацию. Please share the screen, the button, the green button on the bottom of the screen, Dr. Hafiz.
The green button.
Green button in the middle of the screen, on the bottom of the monitor. Я вас уверяю, это будет самая уникальная презентация, которую вы видели.
You can see this. You can see my presentation now.
Я не вижу, кто видит. Could you please on and off try to switch it off and on again? Stop the sharing and switch it on again, please. Sometimes it happens.
What? Oh, Belgium, try again. Is that one here? Yeah, okay. Now you get it, right?
Видно.
Yes, yes, we can see.
Okay.
Let's start.
Hello, everybody. Really, I am sure that you are tired, and anyhow, if you are tired and would like to sleep, please don't snore. And relax, enjoy your time. And I could speak about the current status of control of avian meat abnormovirus and ORT. And the problem related to respiratory disease is a huge problem in poultry in general. The economic impact is decrease of hatchability. Oh, something went wrong. Oh, complicated.
You have to move it up.
Yeah, I do. I try
jump
to
to
do
the
it.
bottom.
Yeah. The life is complicated.
А это PDF разве, да? No, you have to go up on the right side. Just pull the with the mouse.
Yeah,
The bar. The bar on the right side. You can pull it up.
yeah,
Right.
I try to do it.
You are scrolling it, but you can take the bar on the right side and just pull it up to the top. On the side of the screen, there is a bar, the gray bar.
The side, I don't see anything on the side. Huh?
There is a side. Слушай, а как подключиться, помочь? Никак?
So it was good. We speak about that. Yeah.
Okay, let's start.
We have a decreased hatchability, as I mentioned, and then the economic impact is also decrease in body weight and performance. And if the body weight is decreases, that means uneven growth, are bigger than you, as you see here, different between 2 birds at the same age. And also an economic impact, if you send the turkey to the slaughterhouse, we have an increase in contamination rate. If you see here, pericarditis, prehepatitis, air circulitis, and breast button. And the economic impact is that mean if we have diseased birds, we medicate them, and that means increase of medication cost. And the further thing, if you have an additional vaccination cost for some diseases, This means increase also or decrease the economic impact, and the production cost go to increase all the time. What is the cause of the diseases? The cause of respiratory diseases, we have to think about non-infectious like management, litter quality, stocking density, ventilation rate, temperature, ammonia, high dust, and in feed we have a high dust content sometime and or vitamin E deficiency, but we have also several viruses. We heard about that early morning with, for example, influenza. We have a Newcastle disease virus. Is this okay? And we have a bacteria like ORT and Bacillus multicida, Mycoplasma, Chlamydia psittaceae, E. coli. We have a fungus like Aspergillus and parasite like Syngemas. But the kind of ongoing respiratory disease, everybody speak today about coronaviruses, but we have a lot of problem really with respiratory disease in Turkey, with TRT as well as influenza viruses and like avian metapneumovirus like here. And we have a lot of bacterial diseases which can cause respiratory manifestation like Mycoplasma, E. coli, or sometimes Salmonella even. You can find a Botidella and can find fungus infection like Aspergillus. And we told you if we have a viral infection like avian metapneumovirus and we have a bacterial infection beside it, is this mixed infection, meet a lot of problem. What is really the trigger of avian metapneumoviruses? I told you we have the virus, but we have ORT, we have E. coli, we have chlamydia, mycoplasma, Ribella annati pestifer. And if we look for the serological profile of avian metapneumovirus, TRT and ORT, and you can find that the both are going together. If you get TRT at the beginning, you get within the same time ORT, and then we do have a lot of problem with that. Again, also in broiler breeder, not only in Turkey, we have the same situation. In this case, we have an ORT at the beginning and increase by ORT with CRT with a short period of time. And it's the same situation. We do have a TRT, and then we get Chlamydia psittaceae at the end of the rearing cycle. This one is at Flammarion from Belgium, and they make an experimental infection. First, if you have an infection with a Mycoplasma gallisepticum, this is okay. And then after, if you give avian metapneumovirus, they go to increase Mycoplasma, avian metapneumovirus, and then we get ORT and E. coli, and all the time, if you have a mixed infection, you have an experimental infection increase in the mortality and feed conversion rate. If you look for the postmortem lesion for Sachs lesion in percent after ORT, sole challenge in SPF broiler in with Dutch isolate, you can find with a mixed B, there's a lower of a mixed B plus Newcastle disease go to increase. Newcastle disease alone don't make a lot problem, and the control is negative. If you look for example, Ribella annati pestifer with avian metapneumovirus plus Ribella annati pestifer, the center of the positive, if you have only Ribella annati pestifer, is no problem at all. But if you have an infection in addition to avian metapneumovirus and Ribella, you can see here that the number of positive are very, very, very high by re-isolation. How to make a diagnosis? Diagnosis not black and white. The problem-related diagnosis is that the clinical signs and lesion are not specific. Can you follow me? Okay.
Yes, we do.
Okay.
It's okay.
Is that mean we need an accurate diagnosis? And the accurate diagnosis started with avian meat abnormal or what we said, TRT. A lot of people said about that. As the current knowledge that belong to the family Paramyxoviridae, we have a subfamily Paramyxoviridae and pneumovirus. And by pneumovirus, which is the cause of avian meat abnormal or for TRT, is that we have two genus, pneumovirus, and we have an metabpneumovirus which causes TRT and swollen head syndrome in the chicken. Genus pneumovirus causes only swollen head syndrome in chicken. Avian metabpneumovirus is a primarily causative agent of the turkey rhinotracheitis, what we said, TRT. It's appeared to associated with the swollen head syndrome in the chicken, the respiratory disease complex in turkeys, as well as drop and egg production in breeder flock. Really, the history of TRT is started in 1980 in South Africa. Then we see that in 1985 to 1986 in the United Kingdom by Phil Wilding, and in France by Andriel and Guillaume, also in the same year. We get it in Germany at first time to detect it, that was in 1987. And then after we can find in Israel, Austria, Hungary, United States, Japan, Central of America, and Colorado in USA again, and in Chile in 1998, and in Belgium in the same year by Van der Sande. Yeah? We have a lot of variation of the strain, isolation from different laboratories showing close morphological, physiochemical property, and genic relationship. And I show you, based on the molecular analysis of the viral genome and the antigenic differences, 4 subtypes of avian pneumovirus could be distinguished. I'm showing you here that the type A was first detected in United Kingdom, and then in France we found type B, and we also in France they found some viruses not type A or non-type B, and in duck they found a new one with D from France. In United States was really all the time they have a problem with subtype C of TRT viruses. In Belgium they found A and B. In Japan and Brazil was only A, and in Germany, like in Belgium, we found subtype A and B. What is the economic impact of TRT? We have really high mortality. We have increase of contamination rate in slaughterhouse. This is economic impact from if you get the birds all the time, survive, feeding, and at the end of the day get to be distracted in slaughterhouse, this make a contamination rate is too high and very, very expensive. But we have also drop in egg production, and you see also that the eggshell from the turkey eggs are really white in color, not pigmented. Does that mean reduction in eggshell quality and a drop in egg production? And if we look for the egg production in percent in breeder flocks, as we write as in my habilitation, you can find an herd without ORT, there's this one here. Sorry, that's without ART is a low, and if you have a TRT infection, they have an increase or drop in egg production increase all the time, and so on. And egg production in the year after natural infection, as you see here also again, then that we have a very, 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 very high drop in egg production after natural infection. And we have a decrease in hatchability. And even economic losses in broiler breeder flock. The flock with one infection have a clinical signs. There are 3 flocks, and we have a mortality increase by 2%, and decrease in egg production by 3, and by hatchability, they by roughly by the mean 1.7 per week. Avian metapneumovirus, I told you, you can find in turkey as well as in a chicken with swollen head syndrome, and you can see nasal discharge, you can see ocular discharge in the turkey, and you can swelling of the sinuses infraorbitalis in turkey, and sometimes you can find all the lesions within the same birds. We have a submandibular edema, we have an conjunctivitis, swelling of the sinus, and nasal discharge. And again here, submandibular edema you can find in turkey, in many turkey, which really died, and we try to kill some of them to see some picture like that. And this is an old picture because you see that the beak is really cut, upper beak is cut very, very, very short. And swollen head syndrome in chicken due to avian metapneumoviruses, also in layer flocks with the swelling of sinusitis and swollen head. And sometimes we can see nervous manifestation in layer flock due to avian metapneumovirus, like torticollis as you see here. And respiratory manifestation in breeder flocks of layers too. And again, you can find sinusitis, nasal discharge, and closed eye and conjunctivitis. And if you make a postmortem, we have an inflammation in the lung. You can find also tracheitis or hemorrhagic tracheitis due to avian metapneumovirus in turkey as well as in chicken. You can find with a mixed infection some pericarditis and hepatitis. And if you look for subcutaneous if you have a swelling head or subcutaneous edema, as you see here, cases exudate and sepsis, there's a control birth which you don't have any lesion. And in swollen head syndrome, specifically in chicken, you can find also accumulation of pus under the skin of the head. In some cases, in layer flock, we can find otitis media and accumulation of the pus in the ear. Sometimes we can find that peritonitis and false laying, not in the oviduct, but in the body cavity. How is the disease transmitted? The transmission is by direct, via inhalation, airborne, or indirect by contaminated water and litter, or contaminated equipment. This is a work done in the United States, and look for avian metapneumovirus survival in poultry litter. They take autoclophied litter, a non-autoclophied litter, and contaminated with avian metapneumovirus subtype A from Minnesota, and keep that by 12 degrees centigrade, 8 degrees centigrade, and in room temperature. That's why by the group from Nagaraya. And if you look the TRT and its survival in poultry litter, and as I mentioned, we used -12, 8 degrees centigrade, 20 to 25 degrees centigrade. In autoclophied litter, you are still able using a BCR for detected the virus over 90 days by -12. If you look for virus isolation, even 60 days. And if you look by 8 degrees centigrade, again, 90 days with BCR. And if you look for virus isolation, you can find after 30 days. If you keep that by 20 degree to 25 degree, by BCR, you can find till 60 days. And by virus isolation, just for 3 days. In non-autoclavated litter, you can find after 60 days with a BCR, by virus isolation for 14 days by -12, by 8 degrees centigrade, again, long time with the BCR, and 14 days with virus isolation, and by 20 to 25 degrees centigrade, again the same with the BCR. But if you look for virus isolation, after 3 days, you're still able to find it. And the virus really spread with wild birds all the time. And the question about vertical transmission, it is complicated, but experimental infection in laying turkey, hence showing that egg with abnormal shells, as I showed you with the postmortem. We have an egg yolk peritonitis, as I showed you in postmortem picture before. Viral antigen were detected by immune fluorescence test in all region of the oviduct for a short period. The virus has been isolated from magnum and vagina. That's done by Jones in 1988. Does that mean we look again for the vertical transmission? In 2003, they collect a bowl of egg content swabs sample were positive for BCR, and the pooled conal swab from 1 day old and were also positive for the BCR. However, a detection of RNA with the BCR didn't mean that you isolate the virus. They try to isolate the virus and they were unsuccessful. Is this an old paper from 2002, but told also again, we worked a lot with the BCR, and if we really make a right diagnosis, we have to try to isolate the virus. And laboratory diagnosis is this mean we have an direct isolation, identification on typing, or detection with the BCR, and indirect detected an antibody, but we vaccinated a lot of turkey flocks, and serology is useless really, or not effective to make a right diagnosis sometime. And we did tested in our lab in 2004 from BCR. We have a conventional method and single tube, and we can detect it really with both systems, specific fragment confound for subtype A and subtype B. Detection of avian meat abnormal virus subtypes in turkey flocks. We make a serological examination and detection with the BCR also, and we collected 198 sample, and we found 65 in general were positive. And as you see, in 2001, we have a high incidence for subtype A and a very few in subtype B or plus A and B. In 2002, we have a lot of problem with subtype B. That means the subtype changed from 1 year to the other year. In 2003, we have high incidence with subtype A and B, and the mixed infection with both is very low. In broiler flock, similar condition really. Again, we have a subtype A, and then in 2002, just only subtype A, and in 2003, we have subtype A and subtype B well detected. How to control? Hygienic measure and vaccination is very, very important. And we know we tested a lot of TRT strain, the effect of disinfectant on the survival of TRT strain, and we found all the time that the disinfectant is very, very, very good. We use of it BR, formalin, and phenol, and H2N2O2, and all of them are very effective within a short period of time, after 15 minutes, by concentration of 0.5 or 1%. The biosecurity, it is very important. The problem that we have in some farms, a lot of multiple age will reduce by the years, and the vaccination is a very important thing. We have TRT live and inactivated vaccine, and this vaccine is still on the market and widely used. The Muriel was subtype B, that's Aviva or Neovac, or Enterovac, you have a subtype A, Nobilis, Forte Dutch have Polyvac was also A. The question is that because we have subtype C in United States, the question is that have to vaccinate with A, B, or C, and there's some application at that time, the vaccine was A or B, and the challenge with A, B, and C, and vaccine with C, and here you can find A or B, the birds could be infected all the time. With C, you don't have anything, nothing has happened, and if you vaccinate challenge with B, as used in France by Nicolas Estraducci, and by A, as used by Nelo in England, and see it can be effective. Does that mean the vaccination sometimes worked very well and sometimes is not worked enough? The live vaccine, we said pulse without circulating antibody after vaccination are resistant to the challenge. This is very important for Jones, right, that by 2002, and nothing is a change. With the live vaccine, variant or attenuated avian monomervirus incapable produce virus-specific IgA in the tears and IgG in the tear as well as in the serum, and give complete protection against virus challenge 3 weeks later. That means the live vaccine which are available provide a good protection with low antibody response, protected the birds against clinical signs. However, the vaccine not able to prevent the infection by 100%. And I show you here some work from us. We look for the live vaccine in the meat turkey flocks, and we look for SP ratio for serologically, and then we vaccinated by day 1 by spray, 3rd week by drinking water, 7th week by drinking water, and for male by 14 weeks in drinking water. All the 3 vaccination was for male and female, and look for the BCR results, and you can found here that you vaccinated by B, you can detect the B very well, but however also sometimes from A, and then we cannot detect anything, and by male after vaccinated in drinking water, we can detect it subtype A, but not subtype B. And similar with the other flock, in this flock, we can be vaccinated by the same way, but we detected by BCR a lot of subtype A, and subtype B was negative. And as you see here, it is different from flock with the other flock, the bond on the infectious pressure on the farm. The problem related to the diagnosis, if you work it with a BCR, you don't know is it a field strain or
Добрый вечер. Я получил, я так понимаю, там Павлов подписал, а печать-то мы можем поставить, потому что я не понимаю.
Коллеги,
как мы-
выключите,
Дмитрий,
пожалуйста,
выключите,
телефонные
пожалуйста.
микрофоны.
Is
Они
okay?
включаются сами собой.
If we look for disadvantage of the live vaccine, conventional live vaccine can revert to a virulent in unprotected turkey. Incomplete vaccination may allow to vaccine passage. And inactivated vaccine, we have an familial tier 3, we have an Entervet, Nobivac, and Hebra. And if we look for the breeder flock, you have to use live as well as inactivated vaccine. The live vaccine protect against respiratory manifestation. The inactivated vaccine, not. Combination, yes, protect against respiratory manifestation. And if we look for the breeder flock, protection against egg drop, live vaccine, no, but inactivated vaccine and combination between live and inactivated give a good egg production. There's a lot of vaccine which may be currently available, like DNA vaccine in several countries, and like Fowlpox recombinant vaccine, and rational modification of F gene recombinant viral protein, and E.S.M vaccine, and there's some country started to use in over vaccination against TRT, and then hatching egg parent known to be free from antibody to TRT, that means M negative, or parent have antibody to TRT, that's M positive, as a vaccine. Bolovac TRT, alive CB subtype A, can give a good result. In over-vaccination, mostly by Turkey, gone and day 24, and they just vaccinated by 0.8 milliliter at the blunt end of the eggs, and they challenge that with the BOT strain Pitch United subtype A. And the result showing you that protection against challenge after vaccination with 1/10 of the dose of TRT at age 3 weeks, 100% maternal antibody, negative in over, and yes, in positive cases, 77%, and in day old, ME is about 67 to 100%. Does that mean A means that protection without clinical signs and after infection, and the result from several trials. To conclude, in over-vaccination, the result indicates that an over-vaccination with a life-attenuated TRT vaccine is effective against virulent challenge and comparable with vaccination by conventional method. Now I go to second part. I try to hurry up. I know that your time is very short maybe, but we speak about Ornithobacterium ORT.
We have 15 minutes, Dr. Hafiz.
Okay, yeah, okay.
Yeah.
About the history, that ORT is detected in 1991, and the question was a new history or not, a new agent or not. But the history of ORT is really, we isolated a gram-negative pleomorphic root strain, and at that time I was working in Stuttgart, and then we isolated in 1993 from Turkey farms, which I that time supervised them. It is an gram-negative pleomorph root designed, designated in 1994 as Ornithobacterium monotrachealis. And really, if you look, the virus were detected in the United States in 1991, in Germany, as well as in South Africa is the same year. Is a new agent. We speak about the history. Again, it is a gram-negative pleomorphic root, and as I mentioned, was detected in 3 different areas around the world. In South Africa was in broiler, in Germany was in turkey, in the United States was in chicken, as well as in the turkey, and all of them have a respiratory manifestation or respiratory signs. Sometime by postmortem, you can see air-sac turbidity, and then you can find retardation of growth too. That I can pass this one, as I mentioned before, broiler and turkey and so on. But after that, we found also in France, in Belgium, United Kingdom, and Germany, as I mentioned before. We have, at least until today, 18 different serotypes from A to R. And you can find here, we make that by agarogel precipitate or the immune diffusion test, and sometimes some strain have even a cross reaction between A and B, and some they have reacted with B and E. You have to be very careful about that. And we look for ORT, compare Germany with France isolate, and you see really a similar picture, and we have a huge number of subtype serotype A in Germany, but much higher in France, and so on. You can detect it several serotypes and similar between the country. If the cause of the diseases in Turkey, mostly up to 2nd week of age, we have a mortality range between 1 to 15%, and duration of the disease, of course, of the disease 7 to 8 days. In broiler, 3 to 4 days. and mortality 1 to 10%, 5 to 8 days duration. In breeder layers, between week 24 to 52, mortality 1 to 3%, and the duration is longer, more than 21 days. And we have a huge natural host of ORT that, as you see here, from chicken, turkey, duck, ostrich even, and we have in goose, we have in pheasant, we have in guinea fowl, we have in rook, and we have in pigeon too. We isolated the ORT from that. However, the natural host with economic impact is mostly chicken and turkey, and the infection takes place by horizontal transmission, direct contact between infected and non-infected, and indirect by contaminated equipment. The vertical transmission, it is questionable till now, and we are not sure it is really take a transmission by over or not, or vertical transmission. But anyhow, it's a very important thing. We know that TRT and other infection can trigger ORT and pave the way free. Is a pathogenicity trigger under experimental condition. What we did is a TRT, Newcastle disease in a chicken, infectious bronchitis, Portodella avium, E. coli, and management failure. And as you see here, we look at the managed problem for ORT, that SPF by 30 weeks of age, intravenous infected with 10 to 8 colony-forming unit with a serotype A, and we get a technical problem. We have a mortality above to 50%. Investigation and dissemination of ORT in different tissue after a natural infection in commercial broiler using culture as well as a BCR as shown you here. You can really, by bacteriological examination, was very difficult to isolate it, but you isolate it also from the lung and the air sac. But we have a lot of mixed infection like E. coli here. And if we look for the BCR, you can find a lot of positive in all flock tested and in the trachea and the air sacs, and sometimes even in the positive in heart, or in 3 cases. And in the muscle, we can detect the RNA, the DNA from ORT. The problem related to diagnosis is the clinical signs and lesion are not pathognomic, and the clinical signs, as you see before, respiratory manifestation, you can feel like you don't know is it TRT or ORT, conjunctivitis or nasal discharge, and again swelling of the head. In here, in case of the both of them, we have a lesion in the peritonitis and an eosarculitis. Eosarculitis is a very clear lesion with ORT here to see, and we have inflammation of the lung or pleuritis, and we have an accumulation of the pus in subcutaneous lesion of the head. And lesion eosarculitis, different kind of eosarculitis you can see, mostly you can find in a mixed infection, as I mentioned before. And this is a lung, which you can find really a fibrovolent exudate or pus accumulation. And sometimes if you get an ORT and Pasteurella montecida, you can see such lesion. And again, the lung with inflammation. And you can see also again pericarditis and perihepatitis. And we get with the years, we learned a lot that we can find an ORT in the joint as well as in the tendon, as you see here. And we have to be very careful about that. The evolution or classical evolution of ORT is that mentioned by Bartholomew. You can feel tracheal mucus in the first, then respiratory manifestation and the arthritis, and that means you get additional mixed infection with E. coli, you get a mortality and arthritis. We make a challenge for ORT, and we can determine the tendo. The kin makes that tendo isolate 5 out of 6, birds tested 2, 4, and you can see that the lung score is also very high if you have a mixed infection. We can isolate the ORT on blood agar, and we can make an PCR. How to make an prevention and control, hygienic measure, therapy, and vaccination. Hygienic measure, you heard a lot about that before. About hygienic measure is really similar all over, but if you look for the survival of ORT in the letter, this is making United Kingdom and United States by lovers, and by -12 they survive a longer time, by 4 degrees centigrade also longer time. But if you have a temperature from 42 or 37 or 22, you have an can destruct the bacteria within a short period of time. Again, the same vaccine, what we use for TRT, have a similar effect with ORT2. Is that mean aldehyde is a very good disinfectant, and we tested that in vitro. ORT prevention and control, we have to stop multiple age as soon as possible. And the multiple age rearing system, the circulation of ORT at the same farm, even when cleaning and disinfectant were correctly carried out, seem to be okay. And therapy, with therapy, the sensitivity of ORT to the antibiotic is very inconstant and depend on the source of the strain, country, and region. And as you see here, I'm sorry for that you cannot see, but amoxicillin was very, very, very good in this case, and norfloxacin also not good enough compared to the other antibiotic like gentamicin. The only one important thing, if you would like to treat, you have to make a sensitivity test before start to treat. And we found that 98% of the strain from France are sensitive to the norfloxacin, 78% from Belgium were sensitive to norfloxacin. If you use an norfloxacin today, you have a lot of problem. You have really to make a high diagnosis, otherwise you get with some problem. Isolate, well, compare France with Germany, when you can find this origin number, or origin Germany and France, 88 isolate of flux was resistant in the year between 2003 to 2016 and 2005. If you look for the MIC 50 to MIC 90 for German strain and French strain, we can find that in this case that thiamolene was very, 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 very effective in Germany as well as in France. However, the strain in France by MIC 90 was much better compared to that in Germany. Does that mean the sensitivity, you should make the sensitivity in your country, even in your area which you are working on that. If you look for norfloxacin and not function very well, it is MIC is very high here in Germany, because at that time we use a lot of norfloxacin in turkey flock. If you look for the pathogenicity, did the pathogenicity increase during the years? We look that for determine the pathogenicity in a chicken embryo, and we can find really that the pathogenicity are really increased. This is the red color compared to 1991 to 1992, and to 2001, we have an increase really in resistance in the pathogenicity of ORT. And also we look for the pathogenicity to 2006, and we can find in 2003 was very high, but decreased in 2005 and 2006. ORT prevention, vaccination. We have a life in the inactivated vaccine. We started with experimental vaccine at the beginning, and we use inactivated vaccine, and we vaccinated the birds subcutaneously in the head lesion, and we can get a very good antibody titer compared to non-vaccinated control group. And the technical barometer between control and vaccinated, you can find here that the total mortality in vaccinated flock is much lesser than that in non-vaccinated control group in the same farm, 2 different houses. And even you can find the most of the parameters are very good. The contamination rate was 88 birds by female, 500 by male, compared to 124 and 584 in non-vaccinated house. I believe we can pass that here. The feed conversion was the same total mortality. And then...
Dr. Hafiz, 1 minute, please.
Yes, okay. Future approach, we have to use inactivated vaccine or temperature-sensitive subunit mutant or subunit vaccine. And future approach, we need a cooperation and share of responsibility between everybody involved in the poultry production chain in the field, laboratory, university, and the government must be improved. I hope you not get a headache from me. It was maybe too fast and too long, but you asked about that. And if you don't understand anything, I can repeat it if you like. And thank you very much for your attention. And I appreciate your questions if you have someone.
Thank you very much, Dr. Hafiz. I think everybody could applaud now.
Okay.
Я думаю, если бы микрофоны были включены, можно было